Hello, everybody. Just getting started here. So, I wanted to take this time to go live and answer some questions about sports injuries. I am a orthopedic sports surgeon in Houston, Texas. I focus on injuries of the shoulder, hip, and knee in athletic individuals. I typically perform surgeries twice a week and help out athletes who have various injuries and are trying to get back to their sport. So I hop on here weekly to try to answer some questions, just general questions, and provide information about any of your burning questions on the recovery process as well as surgery and injury prevention. So thank you for joining. We are going to get started soon. Want to thank everybody for coming already. Casey, I see you. Gigi, thank you for joining. Aaron as well, thank you for joining. We'll give a couple seconds or minutes just to get everybody in here. Usually get a lot of folks asking questions, and I'll answer as many as I can. If I don't get to your question or your comment, feel free to leave me a DM or comment on my page, and I'll try to get back to you as soon as I can. Again, thank you for joining. We're going to just get a couple more people to join in. And I just want to make it clear that I'm a shoulder, hip, and knee surgeon primarily. So I will try to limit the questions and comments to those areas of the body. I'm not a back surgeon. I'm not a neck surgeon, spine surgeon, foot surgeon. So I will be limiting questions to those areas of the shoulder, hip, and knee if at all possible. Again, thank you for joining, and I will get started. And I will first start with Casey asked a question. Thank you for your question. My foot was crushed and it was amputated. Would you have tried to rebuild the foot or just amputated? Again, I'm not a foot surgeon, but in general, I'm sorry about your crush injury. This is a serious injury, obviously. And when you think about limb surgery in terms of severe trauma to a limb, there are studies that show whether or not amputation versus reconstruction is preferred, and depends on the extent of the injury. There's what we call a mangled extremity score. It depends on that score. And if it's high enough, sometimes, in many cases, amputation is a better option in terms of recovering your function. Thanks for your question. So A Train West said, I tore my ACL and had reconstruction 5 weeks ago. Play OT, how long? I guess the question is, how long until I can play after an ACL reconstruction? Again, my typical guidance on patients who have ACL reconstruction is that it can take anywhere from 9 to 12 months to really go back to your sport at a very competitive level. Sometimes it takes people longer. People may feel better within 6 months, but looking at research, it really takes at least 9 months for the reconstructed ligament to be able to withstand the stress of a sport. Thanks for the question. Matt Hicksmund asked, total meniscectomy at 29, now at age 40. Am I too young for knee replacement? So I guess your question is related to the severity of knee problems after meniscectomy. Meniscectomies are a very common procedure, and we usually try to take as little amount of meniscus as possible because the meniscus is the shock absorber of the knee. And the more you take, obviously, the less shock absorption you have in your knee. So if you had a significant meniscectomy at a young age, it would cause the knee to have arthritis at an earlier age. So I tell patients basically that you want to try to limit having a knee replacement procedure until you are old enough to have it, because knee replacements only have a certain amount of time. Usually 25 years or so is the average. But if you really need a knee replacement, there is no need to suffer through the pain associated with arthritis if you are quote unquote too young. So I tell patients if they need a knee replacement, regardless of their age, or if they need any other joint replacement, regardless of their age, it really depends on your function. So 40 years old, it's fine if that's a necessary procedure at that point to have a knee replacement. So I'm going to skip around and get some questions. If I miss it, send me a comment or a DM. Healing tips for bucket handle tear of meniscus from Jordan. Thanks for your question. The bucket handle tear of a meniscus is obviously a very serious meniscus tear. And for meniscus repair, it can take anywhere from 6 to 9 months to really recover from that type of injury. So thanks for your question. Sorry, I'm getting other questions here. Guest 7596 says, 23-year-old with a cartilage defect in my PCL. Should I get the Oates surgery? So I guess your question is asking about a cartilage defect in your knee. A PCL is not where you have a cartilage defect. So if you have a cartilage defect in your knee, it depends on the size of the injury and the size of the lesion, basically, and your symptoms. So if you have significant issues like swelling, pain, and difficulty doing your daily activities due to a cartilage defect, if that is a significant issue that continues to be a problem, I usually recommend a cartilage procedure. Now, the type of cartilage procedure is different depending on the size of the lesion, where it is. So there are different types of cartilage repair procedures like Oates, which is osteochondral autograft transplant. There is an osteochondral allograft transplant, and there's also another procedure that uses your own cartilage cells to make new cells. So it all depends on the size of the lesion and where the lesion is in terms of what cartilage procedure is performed. So thanks for that question. Jay Valencio says, is it okay not to have surgery on an ACL when you're 28? ACL surgery is indicated for people who have difficulty doing athletic activities or activities of daily living. So if you feel like your knee is unstable with regular activities, or if you're an athlete who is unable to perform in their sport, I recommend an ACL procedure. So it all depends on how your symptoms are. And if you don't have any symptoms, then I don't recommend surgery. But just know that the ACL is necessary to have a stable knee, and sometimes it can protect from other injuries down the line, like a meniscus injury. Question is, do you recommend PRP versus stem cell for ACL? I'm 5 years post-op and 4 years post-meniscectomy. So really, there is no evidence that PRP or stem cell can really make any appreciable difference in an ACL that's torn. There are some people, and I do it sometimes, that add PRP or quote unquote stem cells to the ACL during the surgery. But if you have an issue with the ACL after surgery, there really is no evidence that supports the use of it for any treatment. You can use PRP or stem cells for pain, but not for any kind of healing of a graft after surgery. Jesse McGungiel said, 17 weeks post ACL reconstruction, pain when jogging, worried or no? So in general, I don't start patients jogging for my own practice until at least 4 months post-operatively. And typically the first few weeks, you're going to have some pain in the front of the knee, usually around the kneecap, because of some atrophy and weakness in the quadriceps muscle. So it really is a process. So everyone has ups and downs. So I try to tell my patients that don't get discouraged if they try some new aspect in physical therapy if it doesn't work out at first, because it can take some time to recover. So I'm going to skip around. Sorry if I'm missing your question. Send me a comment if you don't get it. Sorry, I'm just typing a comment for someone else. All right, Ivan said, I had an ACL and meniscus surgery 8 months ago. Just got cleared, but my knee still clicks and hurts. So again, I can talk about my practice. So I don't clear patients to return to sport until 9 months for a reason like this, because 8 months, in my opinion, is not long enough to recover from an ACL. So it is very common to have symptoms of pain, some weakness as well after surgery from an ACL up to 9 months, at least 9 months after surgery, up to 12 months, really, for some people. So 8 months, in my opinion, is an early time to go to a sport, especially if you are being released to a sport. So if you still have symptoms at 8 months, I would really recommend doing some more physical therapy to work that out. Thanks for your question. I'm just skipping around. If I miss your question again, send me a DM. Lots of questions about post-op ACL. So Kenna asks, is tendonitis in the quad tendon common 10 months after surgery? I would say tendonitis anywhere around the knee, the front of the knee, is very common after ACL surgery. That usually is referring to the fact that the quad muscles in general are still a little weak. So physical therapy to work on quad strengthening usually helps that. KT asks, just had a knee arthroscopy and I'm having trouble bending. Is that a problem 3 weeks out? I would say in general, it depends on the type of knee arthroscopy that you had. For simple knee arthroscopy, meaning a very simple meniscus surgery, I typically would imagine that most of my patients have most of their motion by week 4 or so. It depends on the amount of physical therapy that's required and the severity of the surgery. So it all kind of depends on how significant the surgery is, but I would continue physical therapy to work on getting physical therapy for motion as well. Tramika Rios says, after ACL tear and scar tissue removal, why would it still hurt and not have full range of motion? I can't answer your specific question, your specific issue related to your ACL and scar tissue, but typically when you take out scar tissue after an ACL or any knee procedure, it still hurts after that actual procedure because there is some scar tissue that still builds up. And the difficult part about recovering after an ACL or a scar tissue removal is that the patient or athlete really has to work through a lot of the motion to continue having good motion without getting buildup of scar tissue. And so you always lose some motion after a after a removal of scar tissue procedure, because scar tissue starts building up pretty soon after the surgery. So you lose some motion after that initial scar tissue removal. So you really have to work hard at maintaining the motion and not get stiffness. So I'm going to skip around. Sorry if I missed your question again. Mad Dog 3712 says, I have pain in my left shoulder when I lift weights. Any non-surgery ways to improve? So I can't really tell you exactly what your issue is specifically, but I say that in general, people who have issues with their shoulder from lifting weights is usually from a issue with the labrum, which is the gasket around the shoulder that helps to stabilize the shoulder. And people with weightlifting issues can have an issue with their labrum or have some mild rotator cuff issues. And that usually responds to physical therapy, working on scapular strengthening and strengthening the muscles around the shoulder. V45 Hunter says, do you think there will be a way to regenerate cartilage? So the question is, do you think there will be a way to regenerate cartilage? So that's a great question, because that is really one of the holy grails in orthopedic surgery, because a lot of what we do, especially what I do as a cartilage restoration surgeon and someone who tries to preserve the joint, is to try to stimulate the cartilage to either regrow or use transplant techniques to help any cartilage damage. And there currently is not a way to stimulate real mature cartilage regrowth that is not invasive. So I think there will be a way in the future, using some gene modification or some cellular based techniques, to regenerate cartilage. But there currently is a procedure that we do called the Macy procedure that allows us to take your own cartilage cells and regrow them in a lab and implant them. And I do that relatively frequently for cartilage defects. And that's kind of the closest that we have right now for cartilage regeneration. But I think that those types of techniques will improve over the future. So I'm going to skip around here. So Jackson asks, I've had PT and 3 cortisone shots for hip labrum tear with no relief. What's the next move? So hip labrum tear is a painful condition in the hip, which can be felt in the groin, especially with some activities, so such as running, sitting for prolonged periods of time, or squatting. Typically, I would send people to physical therapy and get an injection. I personally don't have patients get cortisone injections into the hip if they have a hip labrum problem. But after one injection, if it really is not lasting relief and they have done physical therapy, I would recommend a hip arthroscopy to fix that hip labrum. And it is a very successful procedure. So hip arthroscopy is getting more and more common. More and more doctors who are trained in it are doing it, and patients have very good outcomes. So I would recommend a hip arthroscopy for anyone who fails physical therapy and gets multiple injections that don't work. Kaysen asks, can the elbow UCL heal without surgery if there are partial tears and a strain? So the UCL can scar a little bit in terms of the injury. So the UCL is a ligament in the elbow that gives stability. It is very common in pitchers and overhead throwing athletes to have an injury to the UCL, and they can have some capacity to recover if the athlete takes time off from throwing, does physical therapy to strengthen the muscles around the elbow, and it can kind of heal with a scar, and patients can return to baseball or throwing sports without surgery. But it has to be a partial tear, and it has to have a small strain, basically, and they have to follow a very strict regimented protocol for recovery. Let me see. I'm going to skip around. Question about Gotti asks, just tore my ACL and bucket handle meniscus tear. What's a good spot to get the graft from? So ACL tears are unfortunately a part of injuries to to athletes in general. And the grafts for ACLs are taken from you. So we call that autograft, or taken from another person, which is a cadaver, dead person. I typically recommend autograft for athletes and young individuals. And the location I prefer to get a graft from in my practice is the quadriceps tendon. I think it's a very good graft. It's a very thick and strong graft, and it's very reproducible. Patients do very well from it, and I've had very good success with it. Now, if you talk to other doctors, they may suggest other grafts based on their personal experience and personal preference, but it really depends on who you go to. And I think a lot of the data is showing that quadriceps graft as well as patella graft are great grafts for ACL reconstruction with low rates of re-tear. So Ethan Lee says, I'm applying to medical school this cycle. Any tips? So congrats on applying to medical school. I think it's a great opportunity to get a great education, obviously, and go into a great field. So I would just say work on your letters of recommendation, make sure you have a well-rounded application in terms of extracurriculars, and do well on the MCAT, obviously, but also don't neglect every non-science course. So you want a well-rounded application in general. Hannah 17 asks, how long is recovery for a labrum repair of the hip and FAI? So FAI relates to femoral acetabular impingement. Again, that's an issue with the hip, where the hip basically has overgrowth of the bone that's causing stiffness and pain in the groin. And a labrum is the stabilizing aspect of the hip. So a hip surgery arthroscopy, the recovery is typically around 6 to 9 months or so after a hip arthroscopy procedure. And you have to do physical therapy. And I think the physical therapy is a very strong component of everything, but it's a very progressive recovery. And I think you should be able to get back to sports or whatever activity that you have your opportunity to go back to. So Hannah Slusinski said, a hamstring graft for my first ACL surgery, retorn 18 months later, patella tendon graft 18 years strong. So again, that kind of really echoes my point with ACL grafts. And ACL grafts, a lot of grafts are used for ACL. Hamstring is one of the grafts that are used. A lot of Europeans use ACL grafts, and a lot of people outside of the US use ACL grafts. Use hamstring grafts. And there have been studies that show that although hamstring grafts are very good grafts, their re-tear rate can be higher than the other grafts, such as the patella graft and the quad tendon graft. So trauma drama says, I'm 2 weeks post-op since a root meniscus tear. This non-weight bearing is horrible. So a root meniscus tear is a very significant injury to the meniscus, and it really requires a very significant time off from the knee in terms of weight bearing, because the root is basically the stabilizing structure of the meniscus, and you have to really take your time recovering from that. And unfortunately, the first several weeks are pretty rough because you're not walking on the knee and not putting weight on it. So it can be tough, but bear with it. Hopefully you get through the next several weeks and recover well. So just skipping around here. So James Gallagher says, thoughts on BEAR ACL reconstruction. So that's a great question. So BEAR stands for Bridge Enhanced ACL Repair. And what that is basically a product that you put in the knee after an ACL repair, which is stitching together the ACL, and it basically encompasses and envelops the knee. Encompasses and envelops the ACL like a burrito, and allows the ACL to heal. And there have been studies that show that the BEAR procedure, as this is called, can enhance healing of the ACL and get people a good outcome after ACL repair. I think it is a intriguing repair technique for the ACL, and I am looking forward to trying it more. So just moving around here. So Shivamatimba says, just got an MCL repair and cleanup of a slight tear of the lateral meniscus on week 6 post-op. So hopefully everything's going well. That's a common procedure I perform. So usually that's a 3-month to 4-month procedure post-operatively to recover from. So Boris Volkic 727 just said, how can I be sure that I tore my ACL? I did MRI, but my knee was swollen in that time. So not sure of your specific question, but tearing your ACL, obviously, I would recommend having it evaluated by an orthopedic surgeon. Other than doing an exam that we do during the office visit, an MRI would definitely show an ACL tear, even if you have a lot of swelling. So usually we can do a clinical exam that would show some instability of the knee, and that would really be clear that ACL is torn, also based on your exam and your history of how you injured it. So I'm just skipping around here. TikToker says, how are you supposed to feel 1 month after ACL meniscus surgery? That varies from person to person. I would say my typical patient, a month after ACL meniscus surgery, they're usually doing a lot more in terms of mobility. They're walking a lot easier. Depends on the type of meniscus surgery. The meniscus part of the procedure actually dictates how quickly they can mobilize and how much weight they can put on their knee. So it kind of depends on how significant of the meniscus was repaired or resected. But for the most part, around 4 weeks or so after surgery from an ACL meniscus surgery, patients are walking a little bit more. They're probably still using crutches if there was a significant meniscus tear that was repaired. but they're definitely a lot more mobile and kind of gotten used to the brace if they have a brace and are doing physical therapy, and the swelling is getting a lot better and pain is a lot more controlled. Wild Outdoor says, I need a third ACO replacement. Had cadaver and hamstring both failed. Can I get it done a third time? So that's a great question. Sorry for your difficulties with your ACLs. So it is common to have multiple ACL tears if there is something abnormal with the knee. So in general, when I see a patient with multiple ACL re-tears, I look for other issues that are happening inside the knee. And sometimes, often the case is there's meniscus tears that need to be treated. There are alignment issues with the knee that need to be treated, or there's something else abnormal inside the knee. So I would say if I have a patient with multiple ACL re-tears, I would look at every aspect of the knee and the alignment of the leg and try to see what different thing that I can do to change the knee to prevent any future re-tears. So I want to do a final procedure for the knee that will not re-tear. So definitely requires a very, very intense look at everything that has gone wrong and what you need to do to make sure nothing else goes wrong again. So again, I'm a shoulder, hip, and knee surgeon. So any other body part, I'm not really going to be able to answer with good insights. So Gabrielle Heredia says, would you recommend a meniscal transplant for a 15-year-old with 2 meniscectomies and 1 repair? That's an excellent question. So it really depends. Can't tell you specifically since I don't know your full story or have not seen your scans, but it depends on the status of the knee, the status of the meniscus. If there really is no appreciable meniscus and there are symptoms, then in general, someone who does not have any arthritis and has a meniscus that is almost deficient, meaning it's almost no meniscus left, then I would recommend a possible meniscus transplant. But in addition to the transplant, you have to look at the alignment of the leg, making sure that the knee is well aligned, meaning that your knee is not knock-kneed or you don't have bow-leggedness in your knees. So there's a lot that goes into determining whether someone is a candidate for a knee transplant and what the proper procedure for that is. So it's a very good question. So skipping around here. Eric Dalbinspec says, does hip FAI cause back pain? So that's an excellent question. There have been studies that show that hip FAI or hip femoroacetabular impingement can mimic back pain. And they found that people who have surgery on their hip have their back pain improved. So it depends on the actual symptoms, but the bottom line is that hip FAI can mimic some back pain. So that should be addressed by an orthopedic surgeon if you think you have symptoms that mimic that. Brody Taylor 9555 said, I had shoulder reconstruction 5 months ago. Am I allowed to go into contact for football? I can't answer your question specifically because I'm not your surgeon, but it depends on the type of procedure. So someone who is a contact athlete, like a football player who's had multiple dislocations, sometimes they require a bony stabilization procedure to the shoulder that requires a period of time, usually about 6 months or so, to allow for that bony procedure to heal before going back to contact sports. Canned Fruit Loops, I think, said, I lost the question. It was somewhere. Oh, Canned Fruit Loop says, does running generally cause your knees to weaken when you're older? So the question really is, does running cause arthritis? I think is kind of what you're asking. So does running cause arthritis? The answer is no, not definitively, but it can cause problems in people who already are susceptible to arthritis. So arthritis is really a disorder that affects people that has a genetic component, a mechanical component, and just an overall age component. And so if you're genetically predisposed to arthritis, plus have issues such as you're overweight or have other injuries to the knee, you will have a higher likelihood of having arthritis. Now, runners who are healthy, who have healthy knees in general, who do not have any predisposition to arthritis, don't necessarily get arthritis from running. So I would say if you have healthy knees, you do not have any predisposition to arthritis. So Z919836 says, I get a stabbing pain in my knee every time I squat. So I cannot give you a definitive diagnosis on live just like this, but I can tell you that if you have stabbing pain in your knee every time you squat, you probably have to get that checked out, because many times that can be a meniscus issue, especially if you have swelling, pain, or it can be a cartilage issue as well. So squatting definitely puts a lot of stress on the knee. And if there is stabbing severe pain, then there definitely is something wrong. And usually it's either the meniscus or cartilage or both. Mad said ACL test showed positive for instability, got an MRI and no tear. What does this mean? So good question. So it sounds like the ACL seemed unstable on an exam. If that happens, usually I would say that might be that person might have just a lot of laxity or a lot of looseness in their joints, and it feels like their ACL is unstable when it actually may not be, or the MRI doesn't quite capture the full tear, and it might be a slight tear that's not necessarily apparent on the MRI. Ale says, do hip labrum tears and hip stress fractures lead to arthritis over time? So I can say that hip labral tears and the syndrome known as femoral acetabular impingement can lead to arthritis over time. And it has been shown that fixing those labrum tears and that impingement can prevent the onset or the progression of arthritis in the appropriate individuals. So hip arthroscopy basically can prevent arthritis if it is handled appropriately. Now, hip stress fractures is a different beast all entirely. So a hip stress fracture does not necessarily lead to arthritis, but it can lead to a hip fracture, like a total fracture, and that can lead to surgery to replace the hip. And so that is actually more of an acute issue that needs to be addressed more definitively. So Refine says, I have no pain, but I have crackling sounds in my knees. Is that cartilage? So that's a very common question and a common issue that I get in my clinic all the time. The quick answer is cracking in the knees is not problematic. We do not get very concerned with it as an orthopedic surgeon and as orthopedics and sports doctors in general, because cracking is a sign that there can be some maltracking of the kneecap or the patella, or there can be some mild wear and tear of the patella. And that means that there might be some cartilage issue that is damaged in the patella. And that's what the cracking is. Basically, think of it as like a gravel road instead of like a nice, smooth asphalt road that the patella is tracking on. But unless it's very painful or unless it causes a lot of symptoms, the cracking sound is not a problem that needs to be addressed, usually. Scoop says, hey doc, I'm 44 and I've had my ACLs repaired. No doc will do knee replacement. That typically is not a big issue with most joint replacement surgeons, so I cannot tell you why a doctor is telling you that, in my opinion, because most joint replacements can do the ACL reconstruction. It just depends. It is a little bit difficult because there might be some hardware in there. There might be some bone tunnels. So if you go to a academic center, usually that has a lot of specialists who do more complex procedures, they should be able to handle a procedure that someone needs requiring a knee replacement after an ACL reconstruction. So skipping around, sorry if I missed your question, send me a comment or DM. Marcelo said, I tore my PCL and MCL. How long am I out and when should I start rehab to get back to sports? So it depends on how this is treated. If you tore your MCL, if you tore your MCL and your PCL, I would usually recommend surgery for that. And surgery is reliable, and with enough physical therapy and enough strengthening, usually takes about 9 months to recover and go back to your sport. So Lauren says, I'm a runner who has had 2 lower leg stress fractures. How do I prevent getting more stress fractures? So for long distance runners, it is common for long distance runners to get stress fractures in the tibia or the shin bones, or even in the foot. And it is even more common for women to get these stress fractures in their lower extremities, because women have a triad that is common for them. If they do a lot of long distance running, they can have disordered eating and disordered basically menstrual periods that leads to osteoporosis, and it's called the female athlete triad. And a lot of runners who do a lot of long distance training can develop this female athlete triad if they're not very in tune with a lot of their nutritional needs. And this triad leads to osteoporosis, which in turn leads to stress fractures at the lower extremity. So if you are a woman who's getting repeated stress fractures of your leg and you're a long distance runner or a very competitive athlete, you should really be in tune with your nutritional needs as well as your hormonal imbalance, and that might be one of the causes for it. So I would encourage you to do a lot of nutritional assessments and speak to your general practitioner to see if you need any other types of supplements for that. So skipping around here. So KJ Hampton said, I had a grade 3 hamstring strain while in football. Should I have guidance surgery on it? So I'm going to say that orthopedic surgeons in general, we don't really go by a grading system of 1, 2, or 3 when there are strains or sprains. We kind of give more descriptive terminology. But basically, a grade 3 hamstring strain is basically a high grade strain of the hamstring, meaning that you had a very significant injury to the hamstring. Now, the question is, did you actually tear your hamstring? Because that's really more of a more definitive description of an injury that would require surgery. So if you had a very big tear of your hamstring tendon, the hamstring tendon inserts or originates from the bone on the pelvis called the ischium. And when you have a hamstring tear, it tears off from that bone. And depending on the gap between that bone and the tendon, usually if it's at least 2 centimeters, that would require surgery. And that surgery would fix that tendon back down to the bone and have you recover. So that's my answer to that. Thank you for the rose, Dr. Elijah. Appreciate the rose. Luke says, and all the other gifts. Luke says, what's the recovery time for a torn ACL and lateral meniscus? I'm getting surgery tomorrow. Wow. Good luck on your surgery. I would say my teaching on the ACL recovery and lateral meniscus depends on what the meniscus surgery is. So if you get a meniscus repair, it makes the recovery process a little bit slower in the beginning, meaning that you may not have as much mobility walking. But in general, the full timeline for recovery after an ACL with a meniscus injury, I still put it at 9 to 12 months in terms of getting back to sport if you do physical therapy appropriately and intensely as possible. So 9 to 12 months is my general answer for something like that. Broadster says, should I have gotten surgery for a partial tear of my quadriceps tendon? I was advised not to. I can't tell you exactly what your injury was and how bad it was, but I can tell you that quadriceps tendon injuries or tendon injuries in general just kind of depends on how severe and how severe your symptoms are. If you really were symptomatic from it and tried a period of rest and physical therapy and still had issues related to the tendon tear, I typically tell my patients that they need to have surgery to fix any tendon issue. So Big Fudge says, what is the recommendation for a partial tear of the ACL with slight tear in my meniscus? So in general, I would say a partial tear of an ACL can worsen over time, especially if you have a tear in the meniscus, because the meniscus helps to give some stability to the knee. The ACL is a primary stabilizer of the knee. And it's really hard, I would say, to call something a partial tear on an MRI. And it really depends on the symptoms. So in that situation, I would really rely on how much symptoms the patient is having. So if they feel unstable, if they tried physical therapy where the knee still does not feel right and they cannot go back to their sport, then I would recommend doing a procedure on the ACL to fix it. So skipping around here, sorry if I missed your question. PMC 31 got a shoulder capsule release a year and a half ago. Shoulder still very unstable. What's next? So I would say I cannot tell you exactly what procedure you had or what your issue was. I don't personally do capsular releases for people with shoulder instability. If you had a capsule release because your shoulder was stiff, that's another thing. And it is not common to have instability after a capsular release unless there was a big release of the capsule. So Jilly says MPFL reconstruction surgery rehab. So MPFL reconstruction is for patellar instability. It stabilizes the patella, which has dislocated usually for people who do the surgery. And the rehab process is really 6 to 9 months. And patients get it and they get back to their sport pretty reliably, as well as long as the procedure is done correctly. Reese says, would you recommend surgery for, Reese says, what would you recommend for a grade 2 AC sprain? So AC is a acromioclavicular joint. It's basically the clavicle and the acromion, the bone on the top of the shoulder. And this is what people refer to when they say they separated their shoulder. So someone who has a mild sprain or mild injury to their AC joint, we would call that a grade 2 or grade 1. And for those, I recommend physical therapy and rest. And I don't recommend surgery for something like that in general. For people who have higher grade injuries to their AC joint, I would recommend surgery based on their appearance and their symptoms and how functional they are or not functional they are. So it depends on kind of their symptoms and how much it's really bothering them. But for a grade 2 AC sprain, that really is not a very high grade strain. And I do not recommend surgery for that situation. So I'm gonna skip around here. Sia said, I had a dislocated shoulder surgery. Can I ever play basketball again? So sorry about your shoulder, but in general, if you have labrum surgery, so the labrum again stabilizes the shoulder, but if you have labrum surgery and have the recovery process go smoothly, you should be able to get back to playing your sport. Now, you might feel some stiffness in your shoulder a little bit, but as long as physical therapy is aggressive and you work well with physical therapy, you should be able to go back to playing basketball or any other sport that you were playing beforehand. So Jesus says, I hyperextended my growth plate on my elbow. I still have issues today after throwing a ball. So if you injure your growth plate in your shoulder or arm or wherever you do it, the growth of that joint, the elbow in this situation, is going to be forever changed, most likely, depending on how significant the injury was. And so if you had a growth plate injury, it is common to have prolonged symptoms for years into your adulthood if that's an issue. So Jay said, I just had surgery on my ACL and meniscus and removing the strips. I see a stitch still in. Depends on how the surgeon closed the wound. So I typically do absorbable stitches that dissolve over time. And so I never have to remove the stitches from my patients and they like it a lot. So just depends on what stitches they use. It sounds like they did not use absorbable stitches in your situation. Um, think depth video. Oh, thanks for that. I'm just moving around here. Anthony says hockey player. So it feels like adductor brevis or pectineus strain, hurts to sneeze still 2 weeks later. So I would say hockey players can get what we call core muscle injuries, which is also known as a sports hernia. So if you still have pain kind of in your lower abdomen with activities, I would recommend getting it evaluated for possible core muscle injury. And a lot of time people confuse it for groin pain or groin pull. So core muscle injuries can be evaluated with MRI and physical exam. Okay, I have about 3 or 4 more minutes here, so I'm going to go through a couple of questions. If I miss it, send me a DM. So I'm trying to skip around. So I'm just shoulder, hip, and knee. So I'm just going to shoulder, hip, and knee questions. If you have that, I don't do foot or ankle specifically. So there's a lot of other questions here. So sorry if I'm missing your question. Let me skip down again. So user some long number says pain where my biceps meets my shoulder. I can't tell you exactly what that is, but usually the biceps causes a lot of pain in the front of the shoulder, and a lot of people get biceps tendonitis, which is extremely painful for a lot of people, and that can be treated with physical therapy and stretching, and usually improves over time, especially with anti-inflammatories too, if you're able to take anti-inflammatories. So user 65, some number says, why do orthos and MDs only refer to physical therapists and not chiropractors? Excellent question. So I have a lot of good experience with physical therapists, and a lot of my protocols are physical therapy dependent. Now, I do not refer a lot of my patients to chiropractors because a lot of the chiropractic medicine requires adjustments and it requires a whole different branch of medicine that I'm not familiar with. And I'm not going to say anything negative about chiropractors, but I'm going to say that I do not know enough about chiropractic medicine to refer to a chiropractor. They have significantly different schooling from what I get in terms of medical school, and I cannot routinely keep up with the chiropractic medicine, evidence-based medicine, and so I don't send my patients to chiropractors. Now, a lot of my patients may go to a chiropractor before seeing me, and that's fine if that's what they want to do, but I cannot, as a medical doctor, in my opinion, I cannot refer my patients to a chiropractor because I just do not understand what they do from a medical standpoint. I'm not saying anything bad about them. I'm just saying, as a medical doctor, I like to send patients to other practitioners that do procedures that I am familiar with and know the evidence behind. Thank you for the rose, Harry. Taylor says, can I hold off on a torn meniscus surgery if I graduate next year and want my senior season? So I guess you are a athlete in school, and it depends on the type of meniscus tear, honestly. It depends on the severity of it, depends on the location, depends on a lot of different things. So, and also depends on your sport, when your season is. It really is variable in terms of when to have a surgery and when to have a meniscus surgery specifically. I deal with athletes all the time, and I have all these questions, and we have this discussion all the time because it really depends on where you are in the season, what you plan on doing after the season, and how severe your symptoms are. If it is not a significant issue, if the tear is not significant and your pain is well controlled, and you are not having significant issues with the knee, like the knee's not getting swollen, the knee's not severely painful, then there is a possibility of getting through a season. Now, it depends on kind of, again, how severe it is and where you are in the season and how severe the tear is. If it is a big tear, I would recommend getting it addressed if there is enough time before the end of or the start of your season for your last season, your last senior sport. So hopefully that answers that question and makes sense. All right, so I'm gonna give it a couple more minutes, like 2 more minutes or so. So someone asked 2 years post-op ACL reconstruction with quad graft, issues with weak quad and kneecap pain. So if you still have a knee pain after an ACL reconstruction, especially with the quad, you can have some quad atrophy that basically just still requires a lot of strengthening. They have had studies that show that people have ACL reconstruction with the quad tendon, they tend to have lingering weakness in their quad. And so that really is a strengthening issue that should be improved with weight bearing, weightlifting regimen to strengthen your quad. Okay. Um, I'm going to answer 2 more questions. I got to get out of here. Um, um, Sorry, just skipping around here. Kayla says, would you suggest a gymnast to medically retire if they have a spinal injury that never healed right? Interesting question. So it depends on the pain and symptoms from that spinal injury. A lot of gymnasts have injuries to their spine called a pars defect. And it's very common for them to have this injury because of all the different extension that they're doing and a lot of loading that they're doing on their spine. So it depends on how severe that pain is, because many times those pars defect injuries cause pain and back pain. If they develop numbness or tingling or other nerve symptoms, that definitely indicates a more significant progression of their back pain. So it all depends on how severe the back pain is and how severe that back injury is. So many times these pars injuries do not necessarily heal on their own. So if the back pain progresses or continues and persists, then that gymnast may unfortunately need to medically retire because all the maneuvers and exercises that gymnasts do put a lot of strain on the back, especially the lower back. So this will be my last question. Thanks, everybody. If I miss your question, just send me a DM and I'll try to answer it. So Syed Ahmed says, at what point should I get an MRI on my knee? I heard it playing basketball and it swelled up. So this is a very good question because it indicates an injury to the knee. The biggest indicators of an injury to a knee, in my opinion, are swelling and pain. If you have a injury to your knee, like you do something, you remember it, your knee either pops or your knee shifts or does something, and then it gets swollen, that is almost always a sign of an injury to the knee. Either the meniscus or ligament or cartilage or something is abnormally injured after something like that. So in that situation, I recommend seeing an orthopedic surgeon and possibly getting an MRI. But the key indicators are an obvious injury, a knee that gets swollen and painful. And that definitely, in my mind and in my experience, seeing a lot of these injuries requires an MRI in that situation. So thank you guys for tuning in, and I appreciate you following along and watching this live. And I hopefully answered a lot of your questions. If I didn't, send me a DM or comment on my page, and I'll try to get back to you as soon as I can. Take care. Thanks. Bye.